We're at part 6 now of pregnancy and human development. And at this point, we're looking at this period of pregnancy. And here the um, drawing that's provided for us by Dr. Merib, the author of the book here, is, to my mind, a little bit like presenting us with a Vogue model or something. She looks like she's having a fairly casual pregnancy. But at any rate, you can see the portions of the anatomy that are going to change, and they are interior. And as a result of those changes, there's going to be pressure on blood vessels of the pelvis, which is an important detail, which means some swelling in the lower portions of the anatomy, feet and ankles and so on. The potential also for varicosities to form due to the reduction in venous return. There's also the issue of pressure against the stomach and other digestive organs, and there's pressure against the diaphragm, which means the potential for shortness of breath. And also, because it's pushing up on the stomach, that means that the quantity of food that one can ingest is a little limited, and the potential for acid reflux is increased. And she'll point out here a number of other things that we need to consider. Let's go through the list here. The effects of pregnancy on the mother. So we'll take care of the effects on the fetus very soon in the next section here. But right now, let's consider what's up with mom. And so here we're talking about the mean duration of pregnancy is 38 weeks from the time of ovulation. Okay, so that means that we're not counting in that case the 40-week thing that's going on with from menstruation. So 38 weeks is the proper numerical length. Okay, there are profound adaptations, and I've decided that this entire first paragraph here in terms of anatomical changes is pretty essential. It says as pregnancy progresses, the female reproductive organs become increasingly vascular, engorged with blood. The vagina develops a purplish hue. This is described as Chadwick's sign. Enhanced vascularity increases vaginal sensitivity and sexual intensity. Dr. Merib points out here that some women are able to achieve orgasm for the first time when they're pregnant. So it's possible that pregnancy is, how shall I say, a potential improvement in the relationship in terms of just the sensation aspect of being close together. Prodded by rising levels of estrogen and progesterone, the breasts enlarge, engorge with blood, and there is color darkening in the nipples, areoles. Some women develop increased pigmentation, a facial skin, and a condition that's has a reference here that might also even occur with the linea alba and the midline. But here they're describing things purely of the face, the mask of pregnancy. So I've underlined this here. The degree of uterine enlargement during pregnancy is remarkable, starting, I think it's actually smaller than fist size at the very beginning. Depends on how big your fist is, I suppose. But at any rate, it becomes quite enlarged. And as pregnancy continues, the uterus pushes higher into the abdominal cavity. And so there's some issues around what the diaphragm is able to do with response to breathing. There's the flaring of the ribs potentially because of this is an interior. This is not a subcutaneous increase like weight gain normally would be in a subcutaneous fat. This is actually on the inside of the abdominal wall, and so the rib flare is a real thing. Also, it says the increased bulkiness of the anterior abdomen. It says changes the woman's center of gravity, and many women develop lordosis, which is the extreme curvature in the lumbar region. Okay, there's this idea of relaxin is the molecule of interest here that softens the connective tissues at the joints and makes it possible for women to, how shall I say, become more flexible in their joints and allow for the increased widening of the pelvic girdle. That's an important aspect that helps with labor eventually, but as we're building up to it, it indicates here that there is results because of the change of weight and the flexibility that's described as that there's a waddling gait. And some women even feel some changes in their feet and ankles because of the relaxin. Okay, so weight bearing becomes different, in other words. So summing up the weight gain, she indicates here that there's no way to really determine what the right amount of weight gain is. And so she's just going to instead summarize what the actual changes in the body would cause a change in weight just from the, let's go over it here, the weight increase results just from the fetal and the placental growth, if you were to consider that, the greater blood volume, etc. Just those specific things would have about a 28-pound change. So as I've indicated earlier, that the difference between a 5'10" or 11" woman and a 4'11" or 5' tall woman, in either case, she's dealing with about a 28-pound weight gain that's entirely inside the abdominal region, in the pelvic region, reaching up into the abdominal region. So there are some consequences to that from being small, and so some of them are described here, and I'll go over these. It's not just from being small, but just the changes in general. So there's this particular placental lactogen. Lactogen is a reference to the breasts and breast milk. Okay, so the placental lactogen, this is human placental lactogen, works cooperatively then with estrogen and progesterone to stimulate maturation of the breasts, the production of milk, lactation, and so on. It also has an effect on the growth of the fetus. Exerts glucose-sparing effect in the mother. So what does that mean? That means that we're going to spare the glucose for the fetus in not for the mom, so to speak, right? Okay, so there is a possibility then of gestational diabetes. This is a really important factor to seriously consider. This is a little bit more common in East Asian women than in the rest of the population of women, partly because of the stature of East Asian women. They're smaller, and their body has not been producing, that is to say, the body has been producing the correct amount of insulin for someone of their size, and not necessarily the size that they need to become in order to be fully pregnant. So this is an issue here. The plasma levels of parathyroid hormone are increased, and there's activation of vitamin D. It turns out that calcium is a very, very important part of what's needed to mineralize fetal bones. But I wanted to go back here to note that 10% of pregnancies have gestational diabetes, but more than half of those women go on to have diabetes type 2 later in life. So that's something to look at. It's sort of a heads up.